Hi, my name is Safa Talla, and my PowerPoint presentation is going to be about the nursing shortage and the strain it causes on healthcare for class EN 102. So, my presentation is going to be talking about the nursing shortage, the effects it has on patient care, nurse burnout, and mental health, my proposed tasks, the timeline, and the budget. So, according to the World Health Organization, nurses make up about 60% of healthcare workers. Before COVID-19, the nursing shortage was 5.9 million, and after COVID, that number skyrocketed to 13 million. Now, safe and recommended patient nurse ratio is one nurse to every four patient, and now the unsafe number and the common patient ratio is one nurse to every eight patients. On the right is a chart of the US by state and the percentages of nursing shortages that they have, and the last reporting was of 2022. Now, patient care is getting affected by this low staffing issues because nurses have majority care and patient contact. So, because they have so much on their plate to overcompensate for less staffing or staffing issues, the patients are getting less nurse contact and they're getting rushed. So, nurses are monitoring the patients less. So, patient falls are increasing and nurses are misdiagnosing or they're not catching things that they would normally do if they had a lot of patient contact. Now, insufficient care leads to medical error, and then the hospital nurses end up being liable for it. On the bottom is the patient to nurse ratio, and as you can see, the less patients a nurse has, the mortality rate decreases per patient. Now, a big thing that nurses experience are burnout and mental health. And nurse burnout is when the stress of a job causes physical, mental, and emotional fatigue. About 75% of nurses experience burnout. And a major thing was COVID. COVID increased the percentages of that. So nurses experienced insomnia, depression, anxiety, PTSD. Now, during COVID, there was a PPE shortage, and 68% of nurses had to reuse single use PPE like the N95 mask, and 62% of those nurses reported feeling unsafe doing it. Now, if I was in their shoe, I wouldn't want to put myself on the line caring for patients and I'm not having the right equipment to do that. So, according to the International Council of Nurses, these psychological traumas led to 1,500 nurses to commit suicide over 44 countries. On the left is a chart comparing other workers to healthcare workers and how they experience different things. Now, as you can see, healthcare workers have way more percentages than all these, and the burnout rate and especially the harassment at work is more than the rest. Now, my proposed task. So, because they have stressful, high-paced work environment and they see a lot of gruesome stuff that other workers might not experience. And because of HIPAA, they can't really talk about what's happening in their jobs. And other might not relate because of the things that they see is not normal for people to see. So all that emotion causes buildup. So what I'm proposing is employers offer free counseling and therapy to whoever's up for it. There are a lot of benefits, some being that it helps with stress management, grief counseling, relaxation skills, and coping skills. And the result would be that they would have a decreased quitting rate, which will increase the nursing staff and it will help patients in turn. And employees need to know that their employers care about their mental well-being and that they're not just there to cash a check. So my timeline and budget, there shouldn't be any timeline on the counseling therapy sessions because everybody copes with things differently. So one person might need like 4 sessions and another one might need like 6 or 7 sessions. So as long as the employer is offering, employees can go however much they want. So employers would have to create a program and budget the expenses for the sessions because it would be free for nurses. And having these sessions free is like an incentive for nurses to attend and get the mental help they need for free of cost because they might not be able to accommodate that for their salary. And this is not just including like what's it called? Free counseling shouldn't just be for healthcare workers, like it should be for everybody, but I'm just focusing on nurses. So, summary, because nurses have more patient interaction and they have a lot of patients to deal with, patients are suffering. and low staffing is causing mental health issues. Most common is burnout. So having an incentive to go to free counseling will help. And that's my works cited. And that's my presentation. Thank you.